Okay. I'm going to just hold on a couple of seconds because I know that it takes people a little bit of time to realize that we've gone live. Um, okay. I'm really pleased and excited to have Hannah Childs here with me. And I'm Yoni Ejo. I'm a doctor and a social worker and adoption coach. And I've also been adopted myself as a child and transracially adopted. So all things adoption, fostering, and working with children. So I'm really pleased to ask Hannah to just give us a little bit of a background of where she's coming from, because we're going to talk about sensory processing difficulties and sleep and lots of other things. So hi, Hannah.
Hiya. So my name's Hannah Childs. I'm the founder of Sensory Wellbeing OT. I'm an occupational therapist. I work with children and families, and I'm a sensory integration practitioner. So do you want me to just tell you a bit about what an occupational therapist does and what a sensory integration practitioner does for those of
I
you who
think that
don't?
would be great.
Yeah. Okay.
Thank you.
So in occupational therapy, it's a holistic therapy, and it looks at your well-being in your physical well-being. So within your physical well-being comes your sensory processing, but it also looks at your sensory processing, your cognitive well-being, your mental health, and your spiritual health. So it's really holistic, and that's why the profession appealed to me in the first place, because I've always been really interested in well-being and physical fitness and well-being, but also was really drawn to mental health. So it kind of was the vocation that really sort of fit everything that I wanted it to. So
Yeah.
it's client-centered, and it focuses on occupation. So it looks at what do you do in your daily life that defines you. So what do you do in your job or in your schoolwork, your productivity, we call it. So for kids, it's them accessing the education, and then it looks at things like their leisure and any difficulties in self-care. So in a nutshell, that's occupational therapy, and we look at the different environments they're in, and that has an impact on the well-being holistically as well. So it could be the school environment, it could be the home environment, their social environment. So who is in their life, how are they impacting their life, their cultural environment, and any institutional environment. So that's their school and things like that as well. So we look at all of those things and how it's impacting on the child or the individual and affecting their well-being.
Right. Wow,
Yeah.
it's very comprehensive. I didn't realize. I suppose when people talk about occupational therapy, they often think about people recovering from illness or in hospital,
Yeah.
but it's much broader than that.
Yeah, it's much broader, and we have a training in lots of different areas, so we're
Mm,
able to be holistic. But I think most people see us as in a hospital, acute medical setting, and we're
mm,
responsible for discharge planning. Um, not always, but we do
mm,
far more than that. So
mm,
with sensory integration therapy,
mm,
we look at sensory processing and how this impacts all of our development and our higher cognitive function. And we work on the basis that we can make a difference on the brain and help with growth and reorganization of the brain through different sensory experiences. So, in a
mm.
nutshell, that's sensory integration therapy.
Right. So, what sort of activities would grow the brain in that way? Just so
So
people can picture quite practical.
if you think of sensory processing, that's like the foundation of our development. So we have our brain, and then we
Hmm.
have our brain stem, our spinal cord, and then we have our senses right at the bottom of our development. So we have our exteroceptors, they're called, and they're the senses that tell us about our external environment. And that's things like our taste, our smell, our touch, our vision, and our hearing. And then we have interoceptors, and they're messages from our internal organs and tell us about how we're feeling inside our body. So it could be that we're thirsty, we're hungry, we've got a full bladder, we need to go to the toilet. And it also informs us of our emotions. So we could feel that our breathing has increased and our heart rate has really increased, and we can interpret that we're feeling anxious. So it helps with us understanding how we're feeling and our emotions. So that's our interoceptors. And then we have our proprioceptors. And our proprioceptors are our body awareness, so an awareness of how we're moving our body, the position in space, and our movement and balance. So all of these together, with sensory processing, all of this information is sent to our brain. It's integrated, so that's where we get sensory integration, the word sensory integration from. So it's integrated, it's processed, and then we have a response to that. So we call it an adaptive response in sensory integration. But what that basically means is our behavioral responses, our emotional responses, and our motor responses. So our motor responses are how we move our body, how we coordinate and sequence our movements. So with typical sensory processing, it's automatic, it's unconscious, so we don't have to think about it, it just happens, and it's usually an immediate response. So if I was to touch a boiling hot pan, straight away I take my hand away, because it was a safety thing, it's a protective mechanism. I don't have to think about it, I know straight away I take my hand away and protect myself. But sometimes when there's sensory processing difficulties, or sometimes it's referred to as sensory processing disorder, sometimes it's not automatic, it's not unconscious, and that response isn't there, or it might not be an appropriate response. And also with sensory processing difficulties, the brain can have difficulties filtering out information that isn't important to you. So right now I can hear noises outside the house and people in the park, but my brain is filtering that information out so I can have a chat with you here, because it's not important for me right now. But sometimes, because they don't have that filtering, they can't filter information out. So an example might be that they can't tolerate labels in their clothes, or the seams in their socks cause them pain. So typically we would put our shoes on and our socks on, and we'd feel them immediately when we put them on, but then our brain filters that information out, because it's not important for us to get to work or get to school or wherever we're going. We don't need that information. But sometimes with like tactile defensiveness and difficulties with our sense of touch, the brain isn't filtering that information out. So that child can have an aversive response all day to that label in their clothes, or feel like they're in pain all day, that they can't focus on anything else.
I've worked with quite a lot of children and young people in the care system who have sort of I don't know whether at the time that I was working with them, and then I'm talking about maybe 10 years ago when I directly worked with young people, that we talked about sensory processing disorders or difficulties, but I'm certainly aware of children who couldn't tolerate loud noises, or lots of music, or didn't like to be touched. Is that all? That's all of the same issues, I'm presuming.
What you described there is modulation difficulties, and it's where, from typical sensory information, they over respond to it, and they have like an aversive response. And it's not just I don't like it, I don't like it. It causes a massive noxious response in them, and they go into their stress response. So if you think about our sympathetic nervous system, that's our stress response, so our fight, flight, or freeze response. So they might be triggered all day long from external sensory information, because of certain noises at school, or certain smells. It could just be smells like other people's body odor. Some people can smell if a woman is menstruating in the room. Most people wouldn't notice that. But if you imagine you can smell that, and it's really strong and it's really noxious, you're not going to be able to focus on anything else. You need to get yourself out of there, because it's so noxious to you. So these aren't, you know, oh, it's my preference that I don't like to play in the sand. It's a really strong response that you have that interferes with your day-to-day participation. And we all have like different sensory preferences. So I really enjoy the beach. I like playing in the sand. I like swimming in the sea. Doesn't bother me at all. But then I've got friends who can't stand sitting on the beach. They would much rather be sat around a swimming pool. They can't stand the sand on them, or, you know, different things like
Yeah.
that. So we all have differences, and those the sort of differences, or our tolerance, I should say, varies depending on the demand and the stress on you at a time. So I've worked with kids who maybe one day the school alarm goes off and they throw a chair across the room in response to the alarm going off. But the teaching staff are saying, you know, the alarm goes off every day and he's absolutely fine with it. I don't think it was the alarm. But actually, if you have loads of stress, you're in your sympathetic nervous system. So your tolerance for any other additional demands is going to be far greater than normal. So, and we're all like that. If you think of like when we're driving a car and we need to park it in a really tight spot, and we're driving along the road, blasting the radio out, enjoying our music, and then suddenly you need to really concentrate and focus to park, you can't listen to the radio anymore. You turn it off to concentrate, because that's too much with the demand of you having to look at your spatial awareness and how you maneuver in the car. So we all respond differently depending to the stress on us at a time.
Yeah. So,
Going.
yeah, absolutely. No, it's fascinating. One thing I was going to ask you is, what's the link between autism and sensory processing disorders? How are they connected, I guess?
So studies have showed that people with autism, or I should say autistic people, they have 80 to 90% of them have sensory processing difficulty. So that's
Right.
what
Okay.
statistics say. So it's common in autism. About 60% of those with ADHD also have sensory processing difficulties, but you can have sensory processing difficulties on its own. So it doesn't have to be as part of a condition, it can just be on its own.
Because I talked to a lady called Anna Knight, who works with children and families who are impacted by ADHD, and I remember that sort of realizing that almost half of the children in care have ADHD, and I don't know, I suppose there's probably lots of theories about why so many young people who end up in the care system have that issue, but it's quite stark, isn't it? So I can imagine then therefore they're probably a larger proportion of them also have sensory processing difficulties too.
Yeah. So another area of sensory processing difficulties that I must talk about is sensory-based motor difficulties. So some of the things we've talked about are modulation difficulties, and then there's sensory-based motor difficulties, as well as discrimination difficulties. There's lots of different patterns that you can get in sensory processing. But with sensory-based motor difficulties, it's you have an immaturity or a delay in your gross motor skills or your fine motor skills. So that's how we plan and sequence and execute our daily activities and movements.
So what would be the difference between what are gross motor skills and sensory? Is gross like running and walking, and the finer ones penmanship and things?
Yeah, so with some of the difficulties that you might see, and it's under the umbrella term of dyspraxia or developmental coordination disorder. Other people may know it as developmental coordination disorder. So with difficulties in that area with fine motor skills, is things like doing up buttons, doing up shoelaces, handwriting difficulties, cutlery skills, and a lot of the time with dyspraxia or sensory-based motor difficulties, you see a delay in the fine motor skills. And that's often because there is a delay in the gross motor skills as well. So gross motor skills are things like running, walking, jumping, throwing and catching. So the sort of skills you'll be developing in PE at school. And what happens in a lot of these children is they can start to get mental health issues because they're comparing themselves to their typical peers, and they might be feeling isolated or rejected in sports because no one's picking them because they're not very good at their ball skills or whatever reasons may be, and they can really struggle. So with these kids, cognitively they can be very intelligent, but because of their ability to write and record the information, it doesn't reflect their intellectual level. So it can be really frustrating. They can feel like their bodies are letting them down. And it's not a matter of, oh, you just need to practice and you'll, be up to speed. It takes them so much longer. It takes them much longer time. So sometimes it will take them years to learn to ride a bike without I've forgotten the word.
Stabilizers.
Stabilizers, that's it. Yeah. So it takes lots and lots of practice, and sometimes it's just having compensatory strategies. So it might be, okay, you really cannot do your shoelaces, so we're going to wear slip-on shoes or Velcro shoes and avoid doing that. Or you really struggle with doing a tie and buttons, so you wear a polo shirt instead that you can just pull on and off. Or it might be looking at using a computer or voice-aided method of recording rather than your handwriting. And if you have a diagnosis of these things in school, you get support and reasonable adjustments to give you extra time in exams and things like that. So I know different education authorities are different, but if you have if you're on the DCD pathway, we call it here in Wales, so it's the Developmental Coordination Pathway. It's a school-based pathway where you're working on your gross motor skills, your fine motor skills, and these are assessed over a period of time.
So I guess there's two things I'm thinking. One is that perhaps children aren't being identified, and so what our carers would need to do is maybe think about whether a child they're caring for might have these difficulties, and to presumably through the GP and the NHS to get a diagnosis. But the other side of it is, I suppose, is also what can they do to make the child's life less stressful. I'm just thinking about so many particularly foster carers, I guess, in the conversations that I've had, where they get really frustrated because the child doesn't get dressed in the mornings very easily, and that could quite easily start off the day in a really contentious, stressful state without knowing or realizing that actually they're not just deliberately being slow. It's because they've got those motor skill difficulties.
Yeah, I think it's such a complex matter, because without understanding what the difficulty is, it's hard for you to be reasonable in your response. So if you think that a child isn't putting their socks and shoes on and getting dressed because they're being oppositional and they're being defiant, but actually that's your interpretation as a carer. So you automatically take that personally, unless you're got a halo. Most of us would take that personally and think it's a behavioural issue. So it's really about understanding your child and their individual needs. And I think with sensory processing, if you come from a background and you have typical sensory processing and people in your family do, it's not even on your radar. So often when people come to me and I'll do an initial assessment, and we basically look at everything. So we look at eating, we look at how they're dressing, how they're sleeping, and it's looking at it through a sensory lens. sometimes it's a real light bulb moment for parents, and they have no idea, because they think, oh, I thought they left the table and wouldn't eat with us because they didn't want to talk to us. But actually, it turns out it's because they've got olfactory, so that's our smell. They've got issues with smell, so they have over responsibility to smell, and it makes them want to gag the smell of the food that they're eating, so they'll walk away. But people might interpret that as you're rejecting the family and you don't want to be part of the family, and then you would act with that very differently to someone who understands that this child doesn't process their sense of smell typically, or their sense of taste, and they feel unsafe in their bodies and what you're trying to feed them. So they're trying to protect themselves by taking them away. So if you had those different narratives of why your child is behaving in that way, you'll respond very differently, wouldn't you? So I think the number one advice is educate yourself so you can understand them. And I think with carers and parents, you are their number one to make them feel safe and understood. So if they don't understand themselves, because everyone else is fine with kicking a ball and playing football, or everyone else is fine with the noise of the hand dryer or noise outside or being in a busy environment, everyone else is fine. It's very isolating for the child because they can't understand why they feel so anxious, or why they're in a massive stress response, or going into meltdown and can't cope. And if you don't understand it as a carer, it's very difficult to support your child, because sensory strategies are very different to using strategies which are like psychological strategies. So if you are experiencing your sensories differently, there's a lot of research, especially with modulation difficulties. There's a lot of research to suggest that you spend more of your time in your sympathetic nervous system than is typical. Right. So that means you're in your stress response, which is in your limbic system, which is your fight, flight, or freeze. So basically, your body is trying to keep you safe. And so usually we're more in our prefrontal cortex, so we're able to learn, we're able to communicate, we're able to problem solve. But when you're in your stress response, you're less able to do that and less able to function. So if you're in a stress response at home, as OT and sensory integration therapists, we'd use physical activities which are calming on the central nervous system. Because if you would talk to a child that's experiencing their sensories differently and it's causing such a stress response, you're not going to get anywhere. It's like trying to have a teachable moment when someone's so stressed out, it's not going to happen. But what we know is through physical activities and different sensory input, you have a calming effect on the central nervous system. So then they're able to access the education more, respond more appropriately to different situations that they find really challenging, and then learn strategies. But it's only when they can understand themselves, and through a lot of support and regulation from the carers, that then you can start introducing strategies that can help them cope with that stimuli or sensory input that they're finding really challenging and difficult. So it's quite a in-depth process. But there's things like we know proprioceptive input is very calming on the central nervous system.
Sorry.
So that proprioceptive input.
You have to explain that.
Yeah, I will explain it. So earlier I said we had like our proprioceptors. So that's a sensory system. So we have our vestibular sense, which is our sense of movement and balance. And then we have our proprioceptors, and it tells us how much force we need to use in our daily movement and where our position is in space. So if you were to in the middle of the night and the lights were all out, you know that you're in an upright position. If you were to close your eyes and put your finger to your nose, you know where your face is. When you're driving, you know where your hand is on the gear and where your feet need to be on the different pedals. And that's because of our proprioception. It's knowing where our body
Right.
is and how much
Right.
force we need to use in our movements. So we know through physical input, so that could be weights, it could be yoga, it could be climbing up a climbing frame, lots of physical input through our ligaments and our muscles and our joints. That sends proprioceptive input, it's called, to our brain, which we
Mm.
know is calming input on the central nervous system. So if
Right.
you had a child that couldn't sleep, and
Yeah.
we know they've got sensory processing difficulties, so it's common for those that are hyper responsive, so they over respond to sensory input. So you might see them covering their ears when normally you wouldn't need to cover your ears, or you might see them responding to light unexpected touch. If someone walks past them, that they respond as if they've been thumped in the back, and it might be that they've just had a light brushing. So that's like over responsivity. And so
Right.
they're in their stress response. So kids that are really in their sympathetic nervous system, they're not the type of kids that go to bed and drop asleep within 5 minutes,
Mm.
because they're in their stress response. And we know you need to be in our parasympathetic nervous system, which is like our rest, our
Yeah.
digest, and our restore system, which helps us to chill out. We need to be there to be able to fall asleep. So if they're in their stress response, how are
Mm.
we going to get them from there to be feeling calm and regulated enough to go to sleep? So
Mm.
you could introduce physical activities prior to bed in order for them to get into that calm state to go to sleep.
Right.
That makes sense.
Yeah. Yeah. Absolutely. Absolutely. And I guess if they're in that heightened state, then, like you say, even something that would normally not upset them or bring them even more heightened is going to have a more pronounced impact.
Yeah.
So suggestions are exercise. What are the other things that parents can do um, when they're aware of their child or parent or carer
I think
can
it's
do
really
to?
important to observe them in their movements, because some kids will be fine with movement, and they might be seeking, they might be jumping all over the sofa, hanging from the stair railings, climbing all over the playground equipment, jumping off, and they're really happy and confident with movement. They might be seeking that input.
Mhm.
They might need more of that input than a typical sensory processing child. So they might need even more of that to feel calm and regulated, to be able to be alert and focus. We call it like a calm, alert state. That's the optimal state that we want someone to be in to access education, for example, or to sit down and eat
Mm.
dinner, to be able
Mm.
to sit calmly. But then you get the other extreme where they have such an aversive response to movement that movement causes so much stress. And this is called gravitational insecurity, we call it. So this child might even feel anxious walking down the stairs because they feel insecure in their bodies and balance. They might
Mm.
not progress in toileting because once they're taken from the potty to the toilet, they're so insecure being off the floor because they feel unstable and they feel unbalanced. And
Right.
if they've got any sort of postural control issues as well, that just makes it even more difficult for them.
Mm.
And then these might be the type of kids that you take to the playground, you spin them on the roundabout, and then they get off and they vomit all over the floor, because
Mm.
the way they process that movement, or vestibular input, we call it, so it's the movement input, is so
Mm.
overloading on their nervous systems that it causes such a huge physiological response in a negative way. And
Mm.
then if I was to get a therapy ball, for example, or a birthing ball, some
Mm.
people call it a birthing ball, but a therapy ball, and bounce a child up and down and get them going back and forth, and they've got vestibular processing difficulties, I'm going to cause them even more stress than by not doing anything at all. It's not going to have a calming or a
Mm.
regulating effect
Mm.
on them. Whereas a child who needs loads and loads of movement and they don't
Mm.
have an aversive response to it, they might be jumping up and down on the therapy board and they find it very calming and organizing and regulating. So it really depends on the individual. So what I recommend for carers is observe your child. So depending on the age of the child, if you still go to playgrounds, watch them. Do they go on? What were you going to say?
No, carry on.
Do they avoid certain movements? Are they really cautious? Are they not willing to climb up on things? Do they choose to sit next to you on the bench instead? Or are they the kids that are climbing up, jumping on top of the climbing frame, jumping down, hanging upside down? Because that would tell you a lot what their sensory systems are telling them that they need. And then what you're trying to do for the kids that are really seeking lots of movement input and they need loads and loads of input, you need to meet that drive and that threshold in them for them to be calm and regulated. And then heavy work after that. So things like climbing or just own body weight work will have a calming effect on them.
Yeah.
Whereas you might have another child who's very switched off and low arousal, so they might need more alerting input. So if they don't have an aversive response to vestibular input, so movement input, they don't have a fear response from it, you might need to get them on the trampoline to increase their arousal so they can talk and so they can engage and interact and access education. So it's so individual. But what you need to do is you need to kind of be their detectives. But really, this is so complex if you don't have a sensory background. So the NHS occupational therapy services do assessments to support kids with sensory processing difficulties. Every authority is different in what they offer. So if you feel that there's any sensory differences, you can contact them. Or there's private OTs like myself that give private assessments and consultations. But there's also lots of information out there for free, or courses and things like that. I offer courses on introduction to sensory processing, but I would really educate yourself. So if you are a new foster parent or a new adopted parent of a child, get as much information as you can from their previous carers or any of their medical records. If in there's indication that there's sensory processing difficulties, then seek help. So there's courses that you can access. It depends how you like to learn, but there's courses you can access. Each NHS authority offer different services, so you just check out what's available to you. And then really try and understand if they have sensory processing difficulties, what is it that they struggle with? How does this affect them? Because often, initially, without having an understanding of sensory processing, you see it in behaviors and emotions. So you see really exaggerated behavioral responses. You seem to see irrational emotional responses. And then an easier one to identify is when they have coordination difficulties. So that's the sensory motor. That's easier to identify because you have that direct comparison of the physical ability that they're showing in their movement. Whereas when it's more modulation or discrimination difficulties, there's no comparison. It's all internal. And we see it in the behavior and how they respond to things. But always look at the signals, what they're telling you. So if they're telling you, I can't wear my shoes, I can't eat that food, really think, is this because there's a sensory difficulty, or is this really opposition, or whatever it may be? And just try and really think about what it can be. And I think once you understand that it's a sensory processing difficulty, it's really important to validate them, because often, without us understanding what sensory processing difficulties they have, without meaning to undermine them, we can say, don't be so silly, this tastes nice, or there's nothing wrong with this toothpaste, or, we all enjoy going to the fairground rides. What's wrong with you? Get on this. I'm sure people do that.
Yeah. Yeah.
It's just not validating them, and if you understand what their sensory preferences are, you're much able to support them better and to prevent any sort of depression or anxiety that can manifest from this.
I'm conscious of the time, but I just wanted to ask you about sleep, because we did talk in the preparation about the connection between sensory processing difficulties and difficulty sleeping, whether you've got any strategies that could help carers with that.
Yeah, I think assuming that the difficulties are from sensory processing,
Yeah.
what you need to do is you have a routine that finishes with lots of calming input. So
No.
if you know your child has issues with putting their pajamas on, and that might be because of tactile processing, it might be that they're sequencing and planning because of dyspraxia. They find it really difficult, and it upsets them before bed because they don't know where to put their arm, they don't know where to put their head. So get all of the things that you know they find stressful and challenging done first. So I would get their teeth done, get their pajamas done. If you read in bed or you expect them to read, get that done right at the beginning of the routine. So it's no demands on them right at the end before bedtime. I'm really hot, sorry.
That's okay.
It's so
That's
hot
all it
today.
is. Very,
Oh.
very hot. It's just started torrentially raining in Manchester,
Has
but it's
it?
still as hot.
Yeah, yeah. Might clear the air a bit.
Yeah,
Yeah,
mate.
so get all of the demanding, stressful things done. I'm just going to shut the window because I can hear someone playing outside. And then think about what you can do that's going to have a calming input on your child. So it might be that you use deep pressure. So it's like a firm pressure all over the body, if they're happy with that. So obviously, if your child has a background of any trauma or any abuse, this might not be appropriate. They might not want any touch, and there might be issues with touch. So it depends on each child. But we know through deep pressure, that's very calming on our nervous system. So that's why when you go and have a massage, you walk out, you feel really chilled, you feel like you could sleep. And that's because of the effect it's had on our central nervous system. So you can use the palm of your hands to apply deep pressure, or you can do activities where they're giving themselves that pressure. So it might be that they're doing some yoga poses or they're doing some physical activities that gives them pressure themselves. You can buy different massagers, but again, depending on their tactile processes, it depends on all of the individuals. And then thinking about the calming environment, so no devices before bed. You might have like very, very low lighting when you're doing this end part of the routine. You might introduce calming smells. So if they like some smells, they might find like certain essential oils that are child friendly. You might use that. And then trying to block out the light, but some children may have anxiety being in a darkened room. So it's very individualized, but they're just some tips. And obviously thinking about what they're eating, sugar, anything caffeinated like chocolate is not a good idea if you're having sleep difficulties. And if we get exposed to sunlight first thing in the morning, that sets our circadian rhythm for the day, that we get melatonin released quicker in the evening. So, for example, if you stayed inside all day and then you went to bed, you get less of a melatonin release, because although it seems that it's really light inside, you don't get as much light inside as you do outside. So if you got your kids up first thing in the morning and you went in the garden and they jumped on the trampoline, even if it's 10 minutes, getting sunlight first thing, and it doesn't have to be sunny, it just has to be daylight, first thing in the morning, it really affects the release of melatonin. So get that done. And obviously think about, are they moving? what sort of movement do they need? So if it's a child that needs loads and loads and loads of movement, they
Mm.
need dampening down before bed to calm them down so they're into that parasympathetic nervous system.
Mm.
So getting exercise, getting movement, thinking about what you're eating, limiting devices, get all of the demanding things that they have an aversive response done right at the beginning of their routine. So teeth, whatever it is, teeth, books, pajamas, and then a really calming routine, and keep it consistent. So it's the same thing most nights. So it's part of the routine, and then it becomes a learned response as well then.
Right. Right, that's really helpful. Very useful. Because I know, I've had conversations with a number of carers or adopters who've had those difficulties and really have challenges at night. So thank you for that. So if somebody wants to find out more about you, or wants to have a conversation about something more specific, where can they find you?
So I'm Sensory Wellbeing OT. I'm on Facebook, Instagram, LinkedIn, and Twitter. I'm only on LinkedIn and Twitter. I've only been on there for a couple of weeks now. Facebook, Instagram. You can go on LinkedIn and Twitter, but you can connect in any of those 4 platforms.
Right.
If you wanted to email me to get on my mailing list, in my mailing list, I send out information on sensory wellbeing and my different podcasts. I send you details of that, and they're going to be all things relevant to parenting a child with sensory processing difficulties. And then there's going to be different guests and experts. That's going to be launching on the 1st of August, the Sensory Wellbeing podcast. But I'll be posting all of that on those 4 platforms. And then if you visit any of those platforms, if you're not on social media, you can email me. It's Hannah, HANNAH, at sensorywellbeingot.com. So you can drop me an email if you're not on social media.
Right. Brilliant. Thank you so much, Hannah. It's really informative, really helpful. And I hope people get in touch and find out a lot more. So thank you for your time.
Okay, no problem.
And I'd love to hear when people have watched it, or what their takeaway was, what the most useful tip is. So do post that under the video, and we'd love to hear from you. All right, thank you, Hannah.
Okay, no problem.
It
Thanks
was a
very much.
pleasure talking to you. Take
Thank
care.
you. Bye.
Bye.